Welcome everyone, and thank you for being here tonight for our presentation on the burden of sexually transmitted infections on the United States healthcare economics. This presentation was created by Learning Team A, Anavan, Jamie, and Tracy.
This epidemic has caused our nation to pour over $17 billion annually into this sector in hopes of addressing its casualties. Despite our efforts, there are over 20 million cases reported yearly, and young people between the ages of 15 and 24 account for over half that number.
The leadership team will discuss tools and methods involved in addressing the challenges of this sector of the healthcare industry, and how the methods and tools are being utilized. They will also divulge a possible solution, and the payment resources that are entailed.
Aside from placing a massive strain on the United States healthcare economy, the Center for Disease Control and Prevention's estimate of an annual $17 billion in costs may be short.
Unreported and indirect costs from out-of-pocket expenses and loss of time and productivity from work are what people face when they or their loved ones contract an STI.
There are no measures for the physical and mental anguish that people must endure, and the lifelong consequences that they are faced with.
Overall, there are about 20 most common sexually transmitted infections, but 8 that are most common among those infected in the United States.
The most common STIs in America are hepatitis B, hepatitis C, HIV, syphilis, chlamydia, gonorrhea, herpes, and human papillomavirus, or HPV.
Human papillomavirus has become the most prevalent in our nation. It is preventable, and avoiding it will avert other life-threatening issues.
Currently, there is no cure, and some of the effects of HPV range from genital warts to a more serious condition of cervical cancer.
Fortunately, there are vaccinations, and routine vaccinations for HPV are recommended for young girls around the ages of 11 and 12. This recommendation comes from the National Committee for Immunization Practices.
Next, we will dive into the tools and methods used to address the challenges of sexually transmitted infections and its economic burden on our nation's healthcare.
This leads us to a cost-benefit analysis. A cost-benefit analysis is a common and more popular technique used in determining an efficient and equitable allocation of resources.
A cost-benefit analysis is essentially required. It helps public sector decision-makers replicate market processes in hopes of obtaining comparable results of those within the private sectors.
Another component of tools and methods used are regulatory impact analysis. There is a simplistic goal when it comes to this type of analysis, and that is to assess whether a situation exists that is systemic in nature and further requires intervention, to define the desired outcome sought through intervention, to describe the various alternatives that might address the problem and bring about the desired outcome, and to compare the benefits and costs of each alternative.
After comparisons are made and the root causes are determined, working regulations can then be put into place, without a hefty impact on the budget reduced. The last tool and method we will discuss is the health impact assessment. Utilizing a health impact assessment method helps in determining which policy, plan, or project may be judged as it pertains to health population. The purpose of this assessment is to offer realistic recommendations to minimize risks and capitalize a healthier lifestyle.
The intention is to address the broader determinants of health that contribute to poor health. Public health leaders are in desperate need to find ways to incorporate concern for and accountability to health outcomes into a wide range of decision-making and public policies.
A health impact assessment is used to introduce health and well-being as a priority, and recognizing that it is the ultimate outcome of economic, social, and political conditions.
Earlier, we discussed some pertinent facts about the human papillomavirus, and since it's the most common of the 8 prevalent STIs in the US, we will put more focus into the HPV. Tools and methods used to address the challenges of STIs lead us to the financial aspects of the problem. We will divulge the details of cost-effectiveness of HPV.
First, let's look into the cost-effectiveness of male HPV vaccinations. Estimates of the incidence, cost per case, and quality of life impact the HPV-associated health outcomes.
Men benefit from the immunity of female HPV vaccination programs, and in this instance, men and women very directly.
Cost-effectiveness of HPV vaccinations would decrease by varying from a sex-specific program to a sex-neutral, or the female program. From a comparative and cost-effectiveness perspective, it would be a better healthcare investment of public and private insurers' dollars to maximize vaccination coverages in pre-adolescent and young females, rather than widely targeting both sexes.
The public payers we are referring to include Medicaid, while the private sectors include health insurance organizations and extend to the US's healthcare reform.
HPV vaccines are about usefulness and cost-effectiveness. Who should get HPV vaccinated, and why, especially with escalating healthcare costs, should be strategically weighed for overall efficiency pertaining to the costs and benefits. HPV vaccinations of 12-year-old males might potentially be cost-effective, partially if female HPV vaccination coverage is low.
However, increasing female coverage would be more of a tactic strategy than male vaccinations for reducing the overall health burden of HPV in the nation's population.
Men and women are equally prevalent to STIs. Young people are more at risk because in the past few decades, they have been sexually active earlier and marrying later. Although in some cases, STIs can be a genetic occurrence, majority of the cases are resulted from risky sexual behaviors, so the most obvious solution to this pandemic is prevention.
Prevention of STIs have many different forms. Some of those avenues are abstinence, having mutual monogamous sexual relations, delaying sexual activities, and reducing the numbers of sexual partners.
Preventative measures also include always using male condoms, and use them correctly, using clean needles if injecting intravenous drugs, whether it's legal or not. It's best to abstain from anal sex, sex with strangers, or violent sex. Avoid having sex if you are being treated for an STI.
Prevention should be taught in the early stages of adulthood. Because people are having sex as early as 11 years old, education about prevention should start here and be continuous.
Getting vaccinated for certain STIs, routine STI testing and screening, and compliance with medical treatment when infected, are all preventative steps that people could take.
Those are just some of the highlights of prevention. Literally, the list can go on and on. Which brings us to the payment resources that are entailed with the challenges of STIs.
Like any other illnesses, STIs have financial resources that stem from the public sectors of healthcare, as well as the private ones. Not to mention, out-of-pocket expenses.
For prevention, some clinics offer free testing and screenings for STIs. They give away free condoms, and there are plenty of free information about the effects of STIs on the internet.
After researching this topic, and its burden on the United States healthcare economy, we've realized that we've touched on a very small aspect of the problem. There's enough information to really talk about this for days, but, to summarize some of the concerns regarding STIs, the leadership team addressed tools and methods used in analyzing the challenges of sexually transmitted infections on our nation's healthcare economics, and how those tools and methods are utilized. Possible solutions have been divulged, along with financial resources that this challenge entails.
The leadership team would like to again thank everyone for being here tonight for our presentation, and we will now take any questions or comments.